Mr. Speaker, I rise today to share stories with you of real people from Colorado who've had trouble with our health care system, who share their stories with me, who wanted me to convey to the House of Representatives and the country what they've been dealing with and how we have this tremendous opportunity to improvement. One of my constituents is Debbie from Boulder. Debbie's son was diagnosed in 2000 with type 1 diabetes when he was just 4 years old. From that moment on, Debbie and her family knew that if at any time their health insurance ended, their son could not possibly be able to get health insurance again at a reasonable cost because of a pre-existing condition. If Debbie's husband were to lose his job, they'd have to get COBRA or pay for insurance themselves out of pocket. They'll always worry under the current health care system that their son might not have continued coverage as an adult, because it takes a very little break in coverage to be unable to receive coverage in the future. Debbie is hopeful that the public option will be available as a backup and as a competitor to the private insurance plans out there. Debbie writes that diabetes is such an expensive chronic disease, and without proper medication, diabetics will go on to comas or seizures with the possibility of death. Debbie's son needs insulin daily and to have glucose testing and supplies to regulate. That's the minimum requirement. But without insurance, Debbie writes, that's an impossibility unless one is wealthy. Debbie has asked the United States Congress to pass the public option and health care reform to take some of the fear from her son's life and from her son's mother's daily worries. There are millions of families across the country like Debbie's. Families that worry about a pre-existing condition that wasn't their fault. It may have been genetic. It may have been a childhood illness. I had a friend who, at age 41, had a heart attack. He lived healthily, ate healthily, worked out. It still happened. For him to be uncoverable for the rest of his life, what kind of system do we have in this country where people like Debbie's son, who's diagnosed at age 4 with diabetes, has a difficult life ahead of them in terms of getting coverage? What we offer under this bill is to ban discrimination in pricing and exclusions based on pre-existing conditions. This would help Debbie's son and Debbie's family and ensure that everybody in this country has the health care that they need and the chance to succeed. Thank you, Mr. Speaker.